Good afternoon and good evening, ladies and gentlemen. My name is Joyce Balagadde Kambugu. I'm a pediatric oncologist based at the Uganda Cancer Institute. I also stand here to present on behalf of the organization SIOP Africa, and I am the continental president-elect of this organization. Before I begin, I want to thank the organizers of this conference, ASCO Africa, for giving me the opportunity to speak about this very important matter. The topic for this discussion is the Global Initiative on Childhood Cancer in Africa. And the reason that we chose this topic is because it is important that as health workers and allied health workers and civil society, and as all people who are interested in childhood cancer on the continent, that we get to understand what global initiatives are in this area, and to also know what efforts have been made on the African continent, and perhaps perceive or get an idea how we can individually or as countries join this effort. So I want to speak to us about the Global Initiative on Childhood Cancer in Africa. By way of a background, annually, more than 100,000 children lose their lives to cancer. 80% of childhood cancers are curable with currently available interventions. The majority of these deaths occur in low and middle income countries. Yet paradoxically, 80% of the global burden of childhood cancer occurs in low and middle income countries. In fact, it was against this background that the Global Initiative on Childhood Cancer was conceived. One of the biggest challenges that we face globally or as health workers and friends of children with cancer and people who are involved with looking after children with cancer is that one, in these low and middle income countries that house the biggest burden of childhood cancer and where the survival rates are very low, there are no reliable data on the burden, the cost effectiveness of interventions, the current health coverage levels, the cost feasibility or health and economic benefits of scaling up effective coverage. So this in a way hampers efforts to improve and modalities and so forth. What about Africa? 40% of new cases of childhood cancer worldwide are in Africa. Many of the types of pediatric cancer in Africa can actually be treated with generic medicines and regimens that are readily adaptable to resource-constrained settings. And I have mentioned a few there: bucket lymphoma, Wilms tumor, and others. In fact, the survival rate of childhood cancer on our continent is 20 to 30%, depending on which literature that you review. So, the Global Initiative on Childhood Cancer that was launched by WHO. And on the left of my screen, you can see the other agencies that were party to this initiative at its inception, including International Agency for Research on Cancer, IAC, the International Atomic Energy Agency, IAEA, the United Nations, and its partners. Immediately after the Global Initiative on Childhood Cancer was launched, St. Jude's Children's Research Hospital and SIOP, the organization, signed on as implementing partners. For purposes of this talk on ASCO Africa, we are going to focus in on SIOP Africa rather. So a little bit more about this global initiative on childhood cancer. As I said earlier, it was launched in 2018. It is aimed primarily at achieving 60% survival rate for children with cancer by the year 2030. By so doing, it will result in the saving of an additional 1 million lives and the doubling of the global cure rate for children with cancer. In this very busy slide, there's a summary of the key points about the Global Initiative on Childhood Cancer. It was expected, or it is the expectation, that by the year 2020, there will be implementation of this global initiative in 6 to 10 countries, and that by the year 2023, there will be about 25 implementing countries of this initiative. There are outputs and activities in this initiative at a national, a regional, and a global level. And there are technical packages that have been developed or have been conceived also under this initiative. The Global Initiative for Childhood Cancer focuses on majorly 6 cancers, including acute lymphoblastic leukemia, Burkitt lymphoma, Hodgkin's disease, retinoblastoma, Wilms tumor, and low-grade gliomas. These 6 index cancers were proposed or have been proposed for 4 main reasons. 1, they're highly curable with proven therapies. 2, they're prevalent in all countries. 3, they represent 50 to 60% of all childhood cancers. And 4, they will help to advance comprehensive childhood cancer services and systems strengthening once appropriately managed, or once infrastructure to manage them is appropriately rolled out. So the question has been asked, what actually influences treatment outcome of our children with cancer on the African continent? And as people who are involved in looking after children with cancer, I am sure that you have conceived or discussed many of these reasons. But for purposes of this presentation, I want to summarize about 7 of them. 1, failure to diagnose or misdiagnosis of these cancers. 2, delayed presentation or diagnosis, and we can relate to some of these. Treatment abandonment, which in many parts of Africa can be as high as 50% or more. Treatment-related death because of suboptimal supportive care mechanisms and other reasons. Drug shortages, lack of consistent adherence to treatment, and use of reduced intensity treatment regimens for many reasons, such as the fact that our children are oftentimes malnourished. If you look very keenly at all of these factors, they are underpinned by poverty. Individual, community, country, regional levels of poverty that result in this conundrum. The burden of childhood cancer in Africa in the past and the outcome of treatment of childhood cancer in Africa was occasioned by so many different things, such as infectious diseases, political instability, language, religion, ethnic diversity, among other things. In addition to these things, we would then have the factors I've spoken about in the previous slide. And for these reasons, childhood cancer was not anywhere on the priority list in terms of government's investing of resources. The situation is different now because 20 or 30 years down the road, a lot of these factors have been dealt with. Infectious diseases are for the most part under better control. There's better political stability and so forth. Childhood cancers are now coming to the forefront as one of the leading causes of death of our children in Africa and other low middle income countries, and as such have become a focus for intervention and great thought. Against this background, we then ask ourselves, the Global Initiative on Childhood Cancer in Africa, where are we? So after the Global Initiative was launched, of those 10 countries that were conceived to be implementing partners by the year 2021, Africa actually has garnered 3 of them. And these include Ghana, which came on board in November 2019, Morocco, which came on board early this year in January, and Zambia, which joined shortly thereafter in February. There are 6 There are rather 10 core projects that have been conceived under this initiative, as you can see on this slide. And pillar number 3 is where Africa has decided to place emphasis in the first instance. All the others are important, but the greatest importance has been put on pillar number 3 as a starting step. And this is the implementation of cancer workforce training packages. It is perceived that without having trained workforce, leaders in pediatric oncology, and these need not be pediatric oncologists. They could be pediatricians, they could be doctors, they could be nurses or other health workers. But the key thing is that they need to have training. And this not be in addition to training to look after children with cancer, but it needs to also be leadership training. It is around this nidus that teams of people who look after children with cancer on the continent and advocacy and eventually rolling out of these 10 pillars in no specific order will then be realized. As a wise man once said, education is the most powerful weapon which you can use to change the world. This was Nelson Mandela. So the greatest effort towards realizing the GICC dream is training for now. And on the continent, there are a number of nurse training programs and physician training programs that are now in full effect, including nurse training programs under the World Child Cancer, training programs under the Global Hope program, and there's also training programs in Francophone Africa. There are also a number of physician training programs, right from the traditional ones that we had before in Egypt, South Africa, and even North Africa. But now there are additional training programs, such as the training program in Uganda at the East Africa Center of Excellence for Oncology. There's also a training program in Francophone Africa. There's a master's in pediatric hematology and oncology at Muhimbili University in Tanzania, fellowship training program in Accra, Ghana. So you can see that Africa is rising to meet this challenge of implementing pillar number 3 and creating leaders on the continent of Africa so that these leaders can drive the agenda of towards meeting the goal of improving cure rates in Africa from 30 to 60% by the year 2030. So in these last 2 slides, I'm merely emphasizing the fact that education is perceived to be the key number 1 step or the springboard from which Africa will emerge from this low survival rate. This is my last slide, and it's really saying that our job is not to prepare the pediatric oncology workforce for something, but rather help the pediatric oncology workforce prepare themselves for anything. Thank you very much for listening to me.